Welcome to the 2021 Nanaimo Work BC Job Fair. We're doing it virtual this year, and we're very excited to have another employer interview for you today. Right now, I'm going to interview Nicole Jensen, who is a recruiter for Island Health. Welcome, Nicole.
Thank you for having me, Peter.
Absolutely. So I'll start off by asking you, how did you get started with Island Health?
Oh, that is a good question. So I started, it's been over 4.5 years ago now as a recruiter. And I was not living on the island at the time. So I was on the mainland and wanted to move to the island and started as a recruiter in Nanaimo at that time.
Great. We are living the dream out here on the island. So
Absolutely.
Every time I see someone come from the mainland, I'm very happy to see that. That's excellent.
Yeah.
And I'm sure there's lots of great things to say about Island Health. It's got a wonderful reputation. What do you enjoy most about working for Island Health?
Oh, there's so many things. I think one of the nice things is Island Health, obviously a lot of people know, is a big organization. We have over 22,000 employees now across the whole Vancouver Island. So with a big organization, it brings a lot of chances for growth and innovation and change. And healthcare is constantly changing and evolving, which is very exciting. So Island Health is a great company to work for. Their values, I feel, closely aligned with my personal values. And just the fact that you're providing care for all of our patients, for 800,000 people across the island is, everyone, regardless of what you do for Island Health, everyone is in some way directly or indirectly connected to that.
Oh, that's a great message, because I know that, when you look at the healthcare system from the outside in, you might tend to think, oh, well, the doctors and the nurses and the HCAs, are the most directly related to the outcome. But you're right, it really is everyone across the entire organization that contributes to that very noble cause. So that's wonderful.
Yeah, it's so true. Everyone plays an important role. I mean, if we didn't have environmental service workers, which are housekeepers, we wouldn't have clean bedding for our patients. So yeah, everyone plays a vital part.
Absolutely. And as a very young man, I was a candy striper way back in the day. So I remember that role well. Yeah. That's a good starting point.
I may still have my uniform somewhere.
Oh, I don't. I wish I kept mine. So with those over 22,000 employees that you mentioned, it may be a silly question for me to ask, what are you hiring for right now? Because you're hiring for lots of things all of the time. But I wonder if there's any positions that you'd like to highlight right now for us.
Yeah, I think we offer a spectrum of positions. A lot of people, when they think Island Health or healthcare, they think nurse or doctor, but that's not the case. I mean, yes, we do hire nurses and physicians, but we hire from the ground up. So positions that don't require a lot of education would be like our food service workers, as I mentioned, our environmental service workers, our housekeepers, and our patient porters. Definitely healthcare assistants. They do a lot of the patient care with our clients and residents. Community health workers, similar, but in home support, where they go into people's homes and provide care there. And then, so many different opportunities, nursing. We have health science professionals, which are professions like physical therapists, occupational therapists, speech language pathologists, dietitian. Yeah, so a little bit of everything. We also have medical device reprocessing technicians. I never forget to mention those because they're also vital in that they clean all of our surgical equipment. And that program or that position does require a program at Vancouver Island University. So yeah, I mean, I could talk about all of our positions, but we would be here for a long time.
Right. And so what goes along with that, of course, my next round of questions would be, speaking about pay and benefits and those sorts of things. But I'm sure with the range of different positions that you have, you also have a very wide range of pay scale and things like that. So that might be difficult to get into. Although what I would be curious to ask is, for those who are not on a specific path, so those who are in an HCA program are on the HCA path, so they probably know a fair bit about the pay scale there and kind of what goes into it and all of those processes. But for someone who's looking to get into the healthcare field, who perhaps doesn't have that training and isn't familiar in that way,
Yeah.
can you speak to kind of entry level positions just to get their foot in the door and experience the culture a little bit?
Yeah, absolutely. So I mentioned kind of I would say the top 3 positions would be like food service workers, environmental service workers, and porters. And just in terms of wages, so food service workers and our environmental service workers would be at $20.56 an hour, as well as laundry workers. And that should go up April 1st because those are all unionized positions and they tend to go up every year a little bit. And then we also have clerical positions too that are $20.36 an hour. So that's like our kind of entry level, I would say, positions. And
Right.
yeah, those are great if you're looking to just get into healthcare and see what it's about. And, maybe later you want to do some training while you're working in those positions. Yeah,
Yeah. And you'd mentioned patient porters as well. Can you describe a little bit about what that role is for those who don't know?
Yeah, so patient porter is also a very important role in our hospitals. And basically, as the title says, they transport patients to and from different units. If they have to go down to CT or something like that, they're basically moving patients and goods around the hospital.
Right.
So I think for that role, people need CPR.
Right. And I would imagine that the training is very important for that as well, because it's one thing to move a box. Really, what you need to know to move a box is to lift with your legs. But when you're moving a person, there's a lot that can go wrong if you don't know what you're doing. So that would be something that while it may be kind of more on the entry level side of things, it's a position really to take very seriously, I would say.
Absolutely. Yeah, because you can be transporting people in a variety of equipment, like hospital beds, wheelchairs, things like that. So yeah, definitely an important one.
Great. And so I will go into the question about benefits, because I would imagine that benefits apply to some island health employees and not others. Can you speak to kind of who receives benefits and what those look like?
Absolutely. Yeah. So generally, a lot of our positions to start are casual. So that means there's no guarantee of hours when you're in a casual position, and you get called for available shifts, and then you decide if you want to take them or bid on them or not. So casual positions do not come with employer paid benefits. We have temporary and permanent positions that have the opportunity for benefits, and it depends on the on the union. We have 4 different collective agreements that all have different benefit guidelines. Yeah, so it's hard to go through each one, but for a lot of the entry level positions I talked about, you would get benefits if you're in a temporary position for over 6 months, or if you're in a permanent position. So usually what we see the path of an island health employee go through is they start casual. And once you're an island health employee, you would apply on those internal postings that are temporary or permanent. And then eventually you would move into one of those.
Great.
And in terms, I should probably mention our benefits plan, back to your So we do provide employer paid medical and dental through Pacific Blue Cross. We also have our pension plan through the municipal pension plan. So that's where if you're in a permanent position, you would contribute some of your salary to that pension, and then Island Health would match that and a little bit. I think they match just a little bit over your contribution. And then we have long-term disability and group life insurance. Yeah, so definitely a full benefits plan. I think that's one of the perks of working in healthcare for sure.
Perfect. And so you mentioned, getting into a casual position and then moving into perhaps a temporary or permanent position. So speaking of kind of movement in that way, is there also upward movement? So if someone was in a given position and they were looking for more of a supervisory role, or they had that experience and they wanted to apply it, is there opportunity for that within Island Health?
Absolutely. Yeah, I find there's a lot of room for professional growth for sure. A lot of our departments do have supervisor and manager positions, so there's definitely opportunity to move into those. We also have a system called Learning Hub where you can take a lot of courses. So I always encourage people that are looking for opportunities and to grow themselves professionally to look at that as well. That's another resource you would have as an Island Health employee.
Great, thank you. Now, one question that we are asking all of our employers for the job fair has to do with COVID-19, of how it's affected their business. And I feel, again, silly in asking, because I don't think that there's any business more impacted by COVID than Island Health, at least on the island. But perhaps you could speak to a little bit the impact that it's had on the staff, and what measures that Island Health itself has taken in order to ensure the safety of everyone, really.
Yeah, I think working in healthcare, even before COVID, Island Health is very much focused on safety, being a healthcare employer. But since COVID, it's just been ramped up tenfold, I would say, or more since then. I mean, any business has had to adjust to COVID, but healthcare definitely has made a lot of adjustments and a lot of changes. PPE gets kind of thrown around as a keyword pretty quick or pretty often these days. That's personal protective equipment for anyone not aware out there.
Now, we've spoken about how wide the range is of types of roles that you have at Island Health. And so I'm about to ask some questions about kind of your ideal candidate. And so rather than looking specifically at different roles, I wonder if there's any kind of generalities. What are you looking for in traits or characteristics of a new hire, kind of regardless of where they find themselves within Island Health?
Yeah, that is a great question, Peter, because it's one we do get asked a lot. And I would say, so for some of the positions that I've listed already that I've mentioned are casual to start, as long as you have the qualifications and you get the green light from the manager, some of the big qualities are really about availability and reliability is a big one as a casual employee. So managers, when they hire someone, they want to make sure that when they're investing money into orientation, that they have someone that's actually going to pick up shifts and be available for work. So that is a big one. I work with a lot of our hiring managers, and that's one of their biggest criteria. And then I would say another huge one is teamwork skills, because I can't think of any position within Island Health that isn't working as part of a team. If you're on the floor, you're working as a part of a large healthcare team. So just being able to navigate that and work with people is also a huge, huge asset. Other than that, I think just hardworking. Healthcare is an industry that never sleeps. We're 24/7, and our work it always seems to be a fairly high workload. So someone that's willing to get in there and do the work, and deal with the stress of working in that sort of environment are also big assets. Yeah.
Right. Great. And for those of you who are watching and will watch other employer interviews, I think you'll probably find some similarities between the way that Nicole's answered that and the way that all of our other employers do as well, because those are such core pieces to a successful employee. If you're hardworking and reliable and collaborative, those are things that you'll find in all industries pretty well, and in pretty well all companies. And so I would also advise job seekers to think about that when you're crafting your resume, and to think about that when you're preparing for an interview, to know that those are the most important things to an employer. So think of ways to highlight those traits, and maybe even think of stories that allow you to demonstrate that you are collaborative, and that you are hardworking, and that you're reliable. Those are all very important.
That's so true, Peter. I couldn't agree more.
Right. So what I'll ask about is an employee's success. So in different roles at different organizations, success is measured in different ways. And I'm curious, of an organization as large as yours, sort of how is that measured? How do you know when someone is brought on, whether after 6 months they're successful in their role? How is that tracked?
That's a good question. We do have probationary periods for all of our positions. So I would say, and they vary in length. It depends on the type of position, the union once again, and if you're casual or permanent. But I would say that's definitely one indicator of success, is if you've successfully passed your probationary period. But more than that, I would say at the 6-month mark, if your manager doesn't instigate it, why don't you have a conversation with your manager to see how things are going, get feedback, work on anything you need to work on. I always say if your manager's up for, a lot of them will do it, but a performance review sometimes, or just a informal session. How am I doing? I think that's really helpful for both parties.
Mm-hmm. And that's something that I think a lot of people maybe wouldn't do instinctively, because there is kind of a fly under the radar mentality that goes along with being a new hire. But
yeah,
if you think about from the employer's perspective, or your supervisor's perspective, this person has just come to me and saying, I'd really like to do a standout job here, and I'm looking for any kind of feedback to ensure that I'm on the right path. So when you think of it from that lens, you might be more encouraged to take that step and to put yourself out there in that way.
Yeah. And like a lot of times our units may have a clinical lead and then a manager. So if you don't want to talk to your main manager, maybe talk to your clinical lead or your supervisor. It's always a good idea to get feedback. Yeah.
Great. So what we'll do now is we'll kind of shift a little bit into the actual application that folks are going to work on and submit to Island Health. So with the resume, first of all, do you actually accept resumes, or is it done in a different way through your application process?
Yeah. So we do accept resumes, but it's all online. Through our website, which is islandhealth.ca/careers. So all of our job opportunities are posted on our website, and then applicants apply through the website as well.
Great. And when you receive a resume, where does your eye go? What do you look for in a resume that's going to tell you immediately whether this resume should be read in more depth?
Yeah, so I think we go over this when we do Work BC workshops usually, but our eye always goes to the top. I mean, obviously you read top down. So sometimes it helps just to have a summary of qualifications at the top of your resume. Because really, what a recruiter or a hiring manager is looking for is that you meet the job qualifications. So if it asks for food safe, do you have food safe? Do you have relevant experience? Just a few bullet points in a summary of qualifications is always helpful, if you don't have to go looking for that information on the resume. And then once the hiring manager sees that you meet the qualifications, then they'll be more inclined to keep reading on.
Right. So for those of you taking notes, under the resume section, put "don't save the best for last," because
Yes,
that is one, you might think of it as perhaps a sales tactic in selling yourself, is that, "Oh, I'm really going to get them with this last line. They're going to love this." Well, if you wait until the end of your resume to put something really important, no one's ever going to read far enough to see it. So right up at the top is a great lesson.
absolutely. Yeah, like as a recruiter, I obviously spend more time, but some of our hiring managers don't have a lot of time. So if they can see it clearly and quickly, that's even better.
Great. And do you accept cover letters as part of the process?
Absolutely. And I would definitely recommend them for sure.
Okay,
Because
perfect.
resumes can be brief, outline of your history, your experience, and your education. But your cover letter is really where you add your personal touches and, mention why you're qualified and why you're applying for the position.
I think you've nailed it, that the cover letter is such a great opportunity to speak to your motivations, to speak to
Mhm.
why it is that you want to be involved, and maybe some of your the personality and the character part of it as well.
Absolutely. Yeah.
Great. And who should they address the cover letter to? I suppose it would depend on the department, but does "to whom it may concern," is that
Yeah.
still acceptable?
That's always, yeah, I would say that, or maybe dear hiring manager.
Mhm.
It's hard to give an exact name because we have so many hiring managers across Island Health. But even, yeah, to whom it may concern, or dear hiring manager or recruiter would be good. We're in an organization like Island Health, we definitely don't penalize people for not trying to find the name of the actual person because it can be hard at times.
Right. Yeah, absolutely. So you had mentioned kind of the beginning of the application process of how to start and what website you should go to. Where does it go from there? So once someone has submitted an application to a
Mhm.
position, what happens to it? Where does it go?
So we get that question a lot because some people feel it may go to outer space, but I can assure you it does not. So it will go to the Island Health team, and then whoever is organizing that posting, whether it be the hiring manager or the recruiter, will have access to review that application. So yes, it actually does go to a person. It doesn't go to outer space anywhere. We are reviewing applications as they come in.
Okay. And so if someone is contacted for an interview, of course, interviews today are a little different than they were
Yes.
uh, last year, or the year
Yeah.
before, rather.
Mhm.
So what does that process look like when someone is invited to interview for a position?
Yeah. It and once again, it varies depending on the hiring manager. I find we are staying away from having people come in for an in-person meeting for the interview for the most part. A lot of them are done via phone or Zoom these days, or WebEx. Yeah,
Right.
virtually, anyways. Um, yeah, so it does depend on the individual hiring
Right.
manager.
And is that typically a one-on-one interview, or do you find panels to be pretty frequent?
It depends on the position. I would say panels wouldn't be so common. Um, Usually it's a couple or a few people doing an interview. Sometimes it might be a manager and a clinical lead, depending on the position. Yeah, but I would say so anywhere from one, so the hiring manager, or a few people. Yeah.
Great. Well, that's actually the end of our formal questions, but I
No,
wonder if there's anything that kind of we missed or that you wanted to speak to, or any final thoughts for those people in our community who are watching and thinking about Island Health as a possible place that they could go.
just that healthcare is a great industry to look at. And like I said, a lot of people think Island Health and they think nurses and doctors, but we have a whole gamut of positions that that aren't directly healthcare related. Even my position and corporate positions. Yeah, there is something for everyone, for sure.
Perfect. Well, Nicole, thank you so much for your time today. You had wonderful information, and we'll make sure to include an email address at the end of this video so that if anyone wants to follow up with further questions or just want to say hello, that you can do so with that. So
I
thank
would
you
love.
very much.
Thank you.